Les updates on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19.
Good afternoon and welcome to the update on COVID-19 in New Brunswick.
Individuals, Dr. Jennifer Russell, the Chief Medical Officer of Health, the Honorable Britt Higgs, Premier of New Brunswick. Les personnes suivantes prendront la parole de la séance d'information.
Dr. Jennifer Russell, Chief Medical Officer of Health, and Blaine Higgs, New Brunswick's premiers, will address you this afternoon. Dr. Russell.
Bonjour à tous et à toutes. Before I begin, I would like to talk a bit about the masks. So you'll see that I'm wearing a mask today, as is the Premier. And this is a precaution due to my recent visit up to Zone 5, which was a very productive visit. And I'm so glad that I was able to get up there with members of our team at the Department of Health. And so because I've been in the orange phase of recovery, where COVID-19 is active, I'm taking every precaution to avoid making myself an agent of its spread, and following the same guidance that I have provided to anybody else who's traveling back and forth for essential reasons to Zone 5. So for the next 14 days after my return from Zone 5, I'll be wearing a mask and asking others who are not distancing and in the same room as I am to do the same. And I will definitely not be attending any large gatherings, and I will definitely be protecting vulnerable people, vulnerable populations, and maintaining physical distance and washing my hands frequently. And I ask this of everyone who travels to and from orange zones. That is what the public health guidance is. So I'm following my own rules. My mom had joked with me a long time ago, very early on in the pandemic, that she was following my rules. So now I'm following my rules. Depuis notre dernière séance d'information, deux autres personnes sont décédées.
Since our last public briefing, we have seen another 2 deaths in New Brunswick due to COVID-19. We talk a lot about statistics related to the pandemic, but let's all try to keep in mind that these are people who had lives and families and people who loved them. The families of these and all the other victims of COVID-19 are grieving today. And I want you to know that every New Brunswicker shares your bereavement. Your loss is also our loss.
And while we have made progress, we must remain vigilant and take extra precautions to protect our most vulnerable citizens. I stopped in to see the public health staff in Campbellton as well as Bathurst. I stopped in to see the staff who were on site at the arenas in Campbellton and Dalhousie on Saturday and Sunday. I met with mayors, I met with MLAs from all around that area, including Beldoon. So there was quite a lot of information that was shared to help everyone understand what it is they can do to protect themselves based on the information of how things have been transmitted in Zone 5, but also the same things that we were seeing in terms of how things were transmitted in Zone 1. In both of those outbreaks, we would like to see people always wearing their mask indoors, especially anytime you're in the workplace with your fellow employees, whether you're on a break, whether you're working or not. That is one of the settings where we were seeing transmission. We were also, and so I was communicating that message, we were seeing people who had mild symptoms and weren't getting tested, so we were giving that message as well. And the message around close contacts. We were seeing some of the spread happening in situations where people in close-knit communities with good networks and healthy networks, that is wonderful for support in mental health. But in a pandemic and an outbreak situation, those numbers of close contacts are not conducive to trying to limit the spread as quickly as possible. So we're asking that people limit their close contacts to their one household bubble in the orange. So the other thing that has just happened is we have a positive case at the residence 4 Saisons. And this is an adult residential facility in Balmoral. And so there is one confirmed case in the facility. And so therefore we're declaring an outbreak. and we are taking very aggressive steps at this moment to limit the impact of this outbreak. So the entire facility is being tested with respect to residents and staff, and I think most of them were being tested today with a rapid test. And so we should get those results back very shortly, and then take next steps in terms of what has to be done to prevent the spread and contain it quickly. C'est pourquoi j'annonce aujourd'hui une éclosion.
And for this reason, I am today declaring an outbreak of COVID-19 at the Résidence 4 Saisons, an adult residential facility in Balmoral. We have confirmed one case of COVID-19 at this facility. We are taking aggressive steps to limit the impact of this outbreak. A mass testing team is now on site at the residence, and all residents and staff are being tested today.
We know that local outbreaks will continue to occur in the months ahead all around the province, and we won't be surprised when that happens, but we won't be unprepared. I did ask one of the epidemiologists that works with us to frame the risks when I say, oh, the risks are going up all around us outside the Atlantic bubble. What does that really mean? Well, in July, 300 cases were diagnosed of COVID-19 on a daily basis in July in Canada. Today, in Canada, we diagnose 2,700 people with COVID-19 a day. That is a very huge increase, which means the risks outside of New Brunswick and outside the Atlantic bubble are huge and continuing to increase. So when we try to do the things that we're doing right now to limit the spread in terms of travel-related cases coming into the province, we also have to be extremely vigilant about what happens when COVID does get into the province and what steps and measures we need to do to be prepared to keep these outbreaks small and help get them under control very, very, very quickly. And that takes everybody working together to make that happen. Obviously, the best strategy is to prevent them from happening in the first place, but again, we can't control the number of people coming into the province for essential work, but we can do things that make it safer. So the vast majority of our COVID-19 cases come from people who have traveled outside the Atlantic bubble. And we know there are about 12,000 people who cross our borders every day for essential reasons, and any one of them can carry the virus. And again, with the numbers going up outside the Atlantic bubble, it's a numbers game. It's almost impossible statistically to avoid this. So many of these people travel to other provinces for work in jurisdictions where infections are on the rise. So as these risks are increasing, we really don't have a choice to do anything but act now, to make changes to make things safer right now. So doubling down on decreasing those risks is very, very important for New Brunswick so that we can get through the winter and be able to celebrate the holiday season in yellow everywhere in New Brunswick. And Cabinet has just approved new measures to reduce this risk. New Brunswickers who travel out of the province for work will be directed to enter a modified form of self-isolation upon return for up to 14 days, depending on their length of stay back in New Brunswick. There will be the option of reducing this time by being voluntarily tested for COVID-19. There is a similar pilot being trialed in Alberta right now. Ours is slightly different, but these new measures that we're doing, implementing right now, will not stop people from traveling for work, which is important for our economy and everybody's well-being, but it will reduce the risks. Again, we cannot reduce the risk to zero. We know that. So what can we do to manage the risks as effectively and as efficiently as we possibly can? So reducing the chance that COVID-19 can spread in our province is of priority, and we're seeing our neighboring provinces and states having difficulty doing this. So today there are 4 new cases of COVID-19 in New Brunswick, and those new cases include in Zone 1, an individual aged 60 to 69, in Zone 5, 1 individual aged 50 to 59, and 2 individuals aged 60 to 69. And I know I have heard people say that they feel more reassured when I announce the new cases as self-isolating at the moment. And I can tell you that they are self-isolating right now. I don't have the information of whether they were already on our list of contacts and were already self-isolating, but when I have that information, I will provide it. And the number of active COVID-19 cases continues to fall, and it is now at 51, and there are 4 individuals that are hospitalized at this time. Aujourd'hui, il y a 4 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick.
Today, there are 4 new cases of COVID-19 in New Brunswick. The new cases are as follows. In Zone 1, an individual aged 60 to 69. In Zone 5, 1 individual aged 50 to 59, and 2 individuals aged 60 to 69. The number of active COVID-19 cases continues to fall and now stands at 51. 4 individuals are hospitalized at this time. And I would like you to keep them in your thoughts.
I was in Hamilton and Dalhousie and Beldoon and Balmoral over the weekend up in Zone 5. And that area I was really, really impressed by the spirit of the people that I met there. I know how determined they are to bring the area back to the yellow phase of recovery along with the rest of the province. I also want to give a shout out to Public Safety and WorkSafe, who had done some inspections over the weekend and did some education, et cetera, to really help increase compliance up there, and I know that they were very successful. So there was a lot of work that has been done in Zone 5, and we're definitely moving in the right direction, but we will keep an eye on the situation and keep an eye on the new cases as they arise. So we are happy that the things that we have implemented in the last week or so have been successful in terms of seeing we're not seeing a continued increase in the number of cases in a dramatic way. So we are very happy in terms of the compliance and how things have improved. But again, we're not out of the woods yet. We do still have a lot of work to do. And I do want the rest of the province to be staying on their toes as well, because again, we know that this can happen at any time in the rest of the province. And I know I did get some information about the outbreak in Calais right now. And so, that's very, very close to St. Stephen. And so I think everybody in that area really needs to be vigilant at this point in time. I also had a message from the Regional Medical Officer of Health down in the South Region, Dr. Barker, and apparently there's an issue in Quispamsis with people flushing non-flushable items down the toilet. I think they're wipes. So I think that's causing a lot of problems with the sewage system in Quispamsis. So that's a note, a request from the Regional Medical Officer of Health in that area. Je tiens à remercier sincèrement toutes les personnes de la zone 5.
I want to sincerely thank everyone in Zone 5 who is following public health advice. Your vigilance and hard work are paying off. Our team will continue to monitor the situation in Zone 5 and reassess on a weekly basis. If these improvements continue, I am optimistic that we will soon have good news for the people of Zone 5. We're all working together as a great team. We will keep this work up to see positive results in the coming weeks.
Cornerstone in our strategy to limit the spread of COVID-19 in New Brunswick. And this week, our laboratory at Georges Dumont Hospital in Moncton has processed more than 100,000 tests since the pandemic began. We are continuing to test strategically, testing the right people in the right places at the right time. And over the weekend, we were happy to see a great turnout in Zone 5 for the mass testing to test for the virus in that area. And we conducted 2,400 tests, of which 2 were found to be positive. So we're looking at that in terms of the indicators for the outbreak, and I'm concerned that the outcome is not going to completely show a complete picture in the sense that we analyzed the data in terms of the age groups that were being tested, and it would be good if younger adults between the ages of 20 and 40 were tested as well in terms of having symptoms. So because we know the virus can affect people of all ages, and certainly in the younger population, they are at risk of transmitting to parents and grandparents. Alors, j'ai des inquiétudes à l'égard du nombre de personnes de ce groupe d'âge qui pourraient.
I am concerned about the potential for infection in this age group, particularly among those who frequently travel to places where COVID-19 is now widespread. For several months, New Brunswickers who traveled outside the province for work have not been required to self-isolate upon their return. This was an appropriate strategy when case numbers were low, like in July, but circumstances have changed and our protocols must keep pace with the course of the pandemic. And this is what is going to happen throughout the pandemic. With new research, with new information, we will continually revise our protocols to show that risks are going to change and information will change and rules will change.
Now undergo modified self-isolation for 14 days upon return. They will, however, be allowed to leave isolation to obtain necessities, so long as they wear a mask and practice physical distancing. These workers will be able to access essential goods and services, including necessities of life and supporting services, healthcare, goods and services required for work, banking and financial services, transportation, animal care and funeral or visitation services for members of their immediate family. In addition, a person can be voluntarily tested for COVID-19 up to 3 times depending on their length of stay in New Brunswick. Testing must be scheduled using the online self-referral tool and will be completed at an assessment center nearest the individual. For example, a New Brunswicker who has traveled back and plans to remain in New Brunswick for 3 weeks before traveling out again will be required to undergo modified self-isolation unless they are voluntarily tested 3 times around days 0 to 2, 5 to 7, and 10 to 12. If the first test comes back negative, they are relieved from modified self-isolation until their next test. And if after the third test they are symptom-free and continue to test negative, they are no longer subject to the modified self-isolation after day 10. And again, we are going to take into account all of the data that we receive from this approach, again, as Alberta is doing with their pilot study, and using that information to inform next steps. Individuals will continue to wear a mask while in public and follow public health guidance. Individuals intending to be back in New Brunswick for shorter periods can be tested the number of times required based on their length of stay. If planning on being here 1 to 4 days, they would need 1 test to exit modified self-isolation, and if they were here from 5 to 9 days, they would need 2 tests. A 14-day self-isolation upon or returning to the province is still required for non-essential travel following vacation, family visitation, or a move to New Brunswick. And that is what we know works the best. Again, what we're doing with the essential travelers is trying to manage the risk because we know it'll never be 0. But we know that the best case scenario is 14-day self-isolation, as we saw with international students. That was very successful, as well as the temporary foreign workers. And any other travel-related cases that you saw pop up on the radar over the course of the last several months. Those people who were self-isolating for 14 days and tested positive during those 14 days could not infect anybody else. So as of right now, these new protocols will increase our chances of catching infections before they spread. Les travailleurs qui arrivent de l'extérieur de la province ne sont pas les seuls.
Workers coming from outside the province are not the only people at risk from COVID-19. It is important for workers in high-risk settings, in particular in the long-term care sector, to monitor their symptoms and be regularly tested.
I encourage everyone working in adult residential facilities, long-term care homes, and nursing homes to be tested every second week. This is vital whether or not you are displaying symptoms of COVID-19. Protecting our most vulnerable citizens requires that those working with them take extra care of themselves. And if you are interacting with any of these people who work in those settings, please be very careful and cautious with your interactions with them. There are many things about COVID-19 we cannot control, but we can take control by watching our symptoms, getting tested when required, even if we think that it's too mild to be tested. Nope, don't second guess it. Get the test. And we follow public health measures. There is a rising tide of COVID-19 all around us. If we fail to act, the tide can eventually overwhelm us, and that is definitely what we want to not happen. So if we stay together and look out for one another, I am confident that we can all keep above the waterline, but it will take a collaborative and concerted effort from every citizen of New Brunswick. Un gros merci. Thank you.
Can everybody please mute your mic? Please mute.
Good afternoon. Bonjour. First of all, I'd like to thank Dr. Russell and her team for spending time in the Campbellton region this past week. I've heard many positive comments. It certainly is reassuring to see her and her team members address directly the concerns. We're on a weekly call with the local MLAs for the region so that they can be kept up to date on any of the evolving issues and the concerns they have currently now of the region being in orange. But we're all optimistic that, that'll improve over the coming days and weeks, and currently a lot of testing is being done to provide the necessary assurance to do so at the right time. To further protect the health and safety of New Brunswickers, we are accepting the recommendation of Public Health, and we are implementing the new COVID-19 border measures for workers entering or returning to New Brunswick from outside the Atlantic bubble. These measures are necessary because close to 95% of the COVID-19 cases in New Brunswick are the result of travel or someone who has been in close contact with another traveler who was positive. As Dr. Russell has explained, workers entering or returning, and particularly in this case workers returning to New Brunswick from outside the Atlantic bubble, are now subject to modified self-isolation directives for 14 days, with the option of returning to regular public health measures in the province by being voluntarily tested for COVID-19 and having negative results and no symptoms. Cette mesure ne s'applique pas aux conducteurs de camions.
This does not apply to local commuters, truck drivers, or persons traveling into New Brunswick under authority of an operational plan approved by WorkSafe New Brunswick, as this already involves a work isolation requirement.
Public health and public safety will be monitoring the impact of this change to inform future travel options. Under the emergency order, travel into the Restigouche County from the Restigouche First Nation and Pointe-à-la-Croix, Quebec, is now restricted to between the hours of 6 a.m. and 10 p.m. Residents of these areas can only enter twice during a 7-day period for essential goods and services, and they must remain in Restigouche County while in New Brunswick. This does not apply to those with exemptions for attending school or accessing healthcare childcare. For the moment, Zone 5 will remain at the orange level of recovery, with the addition of the one household bubble. We encourage residents of that zone to continue to follow the directives of public health and to keep contacts to an absolute minimum. Des agents d'application de la loi additionnelle travaillent dans la zone orange.
We have had additional enforcement officers working in the orange zone to ensure compliance with public health and the mandatory order. They, along with their colleagues at the RCMP and WorkSafe New Brunswick, are working hard to protect the health and safety of New Brunswickers.
Officers have visited 636 businesses and public spaces in the areas around the orange alert level. They also interacted with more than 5,800 New Brunswickers. In total, 18 tickets were issued for violating the Emergency Measures Act, and 81 orders and warnings were issued. A big part of their job is working to educate people about the requirements of the mandatory order. The handing out of a fine or the laying of a charge is usually the last resort. I am pleased to report that their hard work is paying off. The enforcement officers found the compliance rate is now at 99%, and yesterday, no tickets were issued. Ils ont constaté que la population fournit sa part d'effort.
They saw the public doing their part, and they have received welcoming comments from people who are happy about the job our enforcement officers are doing to protect the health and safety of New Brunswickers.
Thanks to the dedicated efforts of everyone who lives in the areas currently at the orange level, will be able to return Zone 5 to the yellow alert level in the near future. I understand there have been a lot of questions about Halloween in the province and what COVID-19 will mean for other important dates, including Remembrance Day and Christmas. Guidelines are available now on the GNB website for both Halloween and Remembrance Day. It is too early to determine what will happen with Christmas, but there are steps we can take now that will result in a happy holiday season for our province. The goal is always to protect the health and safety of New Brunswickers, which is why we are asking everyone to follow public health guidelines for the alert level that your zone is currently in. Taking precautions today means that we will be better able to have a more normal version of celebrations in the coming days. But it is up to you. You must do what is needed to keep yourself healthy and to protect those around you. You must follow the directions of public health and the mandatory order to limit the spread of this virus. What we are asking you to do is not hard, but it is important. We all have a role to play in slowing the spread of COVID-19. En travaillant ensemble, nous pourrons.
Working together, we can protect ourselves, our family, our friends, and our communities. Working together, we can overcome any challenges we face.
Safe and healthy, happy holiday Halloween weekend. Thank you. Merci.
Merci à toutes et à tous. Thank you.
Thank you all.
Proceed with questions from the members of the media. You have the right to pose your question in the language of your choice. Each reporter will have one question and a quick follow-up question. Nous allons maintenant procéder aux questions des journalistes.
We will now take the media's questions. You can ask the question in the language of your choice. You have one question and a quick follow-up question.
Yes, hello. Dr. Russell, it sounds like there's a lot of exceptions to the self-isolation new requirements. How exactly is it going to work?
Jean, the issue around essential travelers not needing to self-isolate other than with people who are working for larger companies and have work isolation plans in conjunction with WorkSafe New Brunswick, that's been in place for a while. Those individuals who have been traveling for essential work have not been required to self-isolate, and obviously that is the increasing risk that we're trying to manage at this point in time. So what we're proposing is a way to manage that risk. Again, we can't get that risk to be ever zero in a pandemic in terms of how people come and go with respect to the need for essential workers to come across, back and forth across the border. So I don't have exact numbers in terms of how many people travel every day for the different types of work and how many people come for a certain length of time. But Department of Public Safety is working on a registration system to be able to capture that information so that we can be much, much more certain of the people that are coming in and staying for a certain amount of time and then leaving. And then on that voluntary basis, again, we're trying to follow a similar approach that Alberta has in place right now with their pilot program to do voluntary testing. And so with that information, one, we will be reducing risks, and number two, we'll be able to capture that data to inform next steps. So this is an improvement over what has been in existence already. And so again, with the increased risks in our neighboring jurisdictions across Canada and also in the US, this is one of the approaches that we're using right now to manage those risks.
Thank you, Dr. Ms. McKinney. Do you have a follow-up today?
Yes, you talk about the voluntary testing being similar to Alberta. Can you tell us more about how the voluntary testing will work?
Well, it's actually going to be a bit more stringent than Alberta's program pilot study. Ours is going to be dependent on how long the person will be in the province. So if they're going to be in the province for 14 days or longer, then they will be tested 3 times in that period. And I believe by day 10, if they've tested negative throughout that time, then they will no longer have to self-isolate. And then, and again, the other protocols will be based on how many days that they're in the province. So if they're staying just for less than a week or 5 to 9 days, it's broken down that way. And I did touch on that during during my remarks in my speech.
Thank you, Ms. McKinnon. Thank you, Doctor. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, you mentioned that Atlantic Bubble border guards have been relocated to monitor the Quebec borders and international borders. Are any of these guards stationed in Charlotte County? And I'm also wondering, are any of these modified self-isolation guidelines for essential workers, are they also to follow by international border, people who cross the international border for work too?
The requirement for travelers coming in that we have the day-to-day essential workers that are coming across our borders, that continues and as it has for some time. The new requirement is based on travelers that would go out of the province and work for a period of time, maybe 2 or 3 weeks, and then come back. And so the focus is anyone leaving the province for that period of time and then coming back home will fit into this new category of, like we've had a modified self-isolation, like we reduced that back 4 months ago or so. This brings in a heightened consideration to someone who's been away, particularly in the hot zones in the rest of the country, and then doing the testing, as Dr. Russell has described, in a voluntary basis, but determining their condition. It will apply to anyone that was leaving our province for a period of time and then returning.
Thank you, Premier. Ms. Hogarth, do you have a follow-up?
It's a little bit about the border guards. Are there border guards stationed in Charlotte County? Also, Campobello Island residents are allowed to enter the U.S. to obtain essential goods and services. But there also seems to be some confusion about what qualifies as essential. For instance, does that include dining in restaurants? And is there any way to monitor the Campobello Island border to make sure that people are just using the border for essentials?
We did discuss that this morning in our COVID cabinet committee, and to clarify concerns and the regulations around traveling to and from what we've set up now with the Listigouche First Nations community and Pointe-à-la-Croix is basically we're looking at doing that same thing for Campbellton area, Campobello, and the idea is to ensure that Campobello residents can get through to New Brunswick, have a consistent rules and regulations to follow when they're entering into New Brunswick from Calais, or when they're going back into Campobello from Maine. Also looking at essential services there is being evaluated right now, so the ones who would be right there on the border to go into Lubec, how that might be managed. So those issues are all being looked at right today, with the intent of making some improvements here to make life easier for residents to come to and from Campobello Island.
Thank you, Ms. Hogarth. Alan Deering, The Bend.
Good afternoon. Thank you, Bruce. There has been a lot of talk, especially in Nova Scotia more recently, about the Atlantic bubble teaming up with Cuba to form a Cuba bubble. Dr. Strang yesterday said that this is probably not a good idea, and even if it does go ahead, there'll be a 14-day quarantine upon return. I just wanted to get perhaps Dr. Russell's thoughts on the possibility of bubbling with Cuba. How do you feel about that, Dr. Russell?
Well, somebody asked that question to me either yesterday or the day before, and I thought it was an interesting idea. But again, the risks as of right now, in terms of anything that we do with the bubble, would have to be decided upon as a collective. So the 4 provinces together would have to agree on that. And I haven't really had any conversations myself personally, but anyway, any changes to the bubble would have to be agreed upon by all 4 Atlantic provinces.
Mr. Deering, do you have a follow-up today?
Yes, I do. This is probably more of a federal question, but I'll throw it out there anyway. Large airports, Toronto, Calgary, they're setting up temperature scanners. Is there any possibility, have either Dr. Russell or Premier Higgs heard if these temperature scanners will come to smaller airports anytime soon, like Moncton, Fredericton, St. John, for example?
I haven't heard that myself, but in terms of the technology and what that information can tell us about travelers, we know that the symptom of fever in patients with COVID can be fleeting, so it can last for a short while and go away and then come back. And from a scientific perspective, we do know that about the scanners in terms of what information you get from taking people's temperature who are traveling. But certainly with the changes that we're making with respect to essential travelers right now in terms of the voluntary testing, we're very confident that we're going to hopefully gain a lot of information moving forward on how safely we can accommodate people traveling in and out of the bubble and in and out of New Brunswick.
Thank you, Mr. Deering. Thank you, Dr. Savannah Odd, Telegraph Journal.
Hello. I believe this is a question for Dr. Russell, but it honestly could probably go to the Premier as well. As you guys know, the COVID Cabinet Committee, of course, is there to hold government accountable on COVID-19 policy as it would in the legislature. And of course, the Department of Health has said committee members won't be able to know when an outbreak starts from a person who's holding a work exemption. So I guess I'm just wondering, what is the point in having that COVID Cabinet Committee if the members aren't able to receive information such as that in order to assess the success or failure of public health policy, in this case, the work exemption?
So the question you're asking is around, again, travel and how imported cases are getting into New Brunswick, whether it's from essential travel or whether it's from a non-essential travel, and whether the person had an exemption to self-isolate or not. And again, all the things that we're doing right now with respect to making changes around that, because of the increased risks outside of our jurisdiction, take into account all the information and data that we have right now and research. With respect to balancing privacy in these situations, it is very delicate, and I do understand the public wanting to know all of the information, but from a public health perspective, it is our duty to provide information to protect the public. If there's no risk to the public, then I don't have an obligation to share that information in terms of compromising somebody's confidentiality, risking stigma, risking persecution on social media, risking having death threats, et cetera, as we've seen in other types of situations. So the risks and benefits and pros and cons of sharing information that's necessary is very much a consideration, and we do have close contacts with our discussions with our privacy representatives, and so we do take that into account when we're making these decisions. Secondly, everything that we bring to COVID Cabinet in terms of public health recommendations, we supply the data and research to back up all of our recommendations. So if there was information that was private that we were using to support a recommendation, then obviously it would be couched in a presentation in terms of, here's information that we know about patterns of transmission, about risks outside the Atlantic bubble and outside New Brunswick, et cetera. So we frame the risks when we give our recommendations so that we are giving very, very accurate information around how to manage those risks, and then government then makes the decisions around those recommendations. So I don't have any reservations or qualms about sharing information that's necessary to protect the public and necessary to support arguments and recommendations from an evidence-based and a research-based perspective while protecting people's privacy.
Ms. Odd, do you have a follow-up?
I do, thank you, Bruce. For just on today's outbreak, I'm wondering, did the resident at the facility who tested positive share a room with any residents? Are there shared rooms? And do we know if the staff at the home work exclusively at that residence?
So we're early on in our investigation, and I don't think there's any more information that I can give you other than there is an outbreak that has been declared because of a case, and rapid testing was done of all of the residents and staff today.
Thank you, Ms. Odd. Thank you, Dr. Jean-François Boisvert, L'Acadie Nouvelle.
I will start with asking for a decision, a precision from Dr. Russell. There are a lot of new cases coming from the Gaspé region. Are there people who are coming from this region for a long period? No, that would be for everybody. We are asking people who are working in nursing homes to be tested up to twice a week, so it's really open to all essential workers. Thank you. Mr. Boisvert, do you have a follow-up? Yes. Tomorrow, Friday, will be the last working day for the CEO, Yves Lantaine, of Vitalité. Could you please tell us who will be occupying his position on Monday, because his position will be vacant?
That is true. Joseph Kango retires tomorrow. The decision hasn't been finalized yet on who will be taking his place. Certainly, I wish Gilles the very best in his retirement. I think he served our province well and the Vitality Network very well. And we will be making the decision in the coming days or weeks.
Merci beaucoup. Thank you, Premier. Merci, Monsieur Boisvert. Marie Sutherland, CBC.
Hello, yes, question for Premier Higgs. Vitality has announced mass testing tomorrow for Beldoon, and Mayor Noel had told CBC News last week there was a confirmed case at the NB Power generating station and that other employees were being tested. Just wondering what's the current situation at that plant and in the community?
Well, again, confidentiality reasons, when we're doing our investigations, we communicate directly with the cases involved, and we communicate directly with any risk settings, whether it's a business, whether it's a school, etc. So I don't really have any other information other than for all the cases in the outbreaks in Zone 5 with respect to anybody who is a diagnosed case, they are self-isolating at the moment for 14 days, and any of their close contacts are obviously self-monitoring, and we're watching and waiting what unfolds there. But again, I can't comment on individual cases specifically.
Thank you, Dr. Ms. Sutherland. Do you have a follow-up?
Yes, I do. Dr. Russell, there's a hockey tournament coming up in St. Andrews, and I'm understanding that the local medical officers heard from some citizens that are worried about a large gathering of people from across the province being in the town. Just wondering what's your position on that event and what precautions are being taken by the organizers?
My understanding, and I can confirm this, that the Regional Medical Officer of Health has seen the plan, the operational plan, and who will be involved and who won't be involved and what types of precautions are in place with respect to that plan. My understanding is it meets the public health standards in terms of what's allowed and what can be done safely. And that is the understanding information that I have on that situation right now.
Thank you, Ms. Sutherland. Jonathan McInnes, CTV.
Hi, Dr. Russell. What prompted the mass testing clinic in Beldoon for tomorrow?
Well, we met with the mayor of Beldoon last Friday, and there was an intention to do that testing along with the Campbellton and Dalhousie sites at some point. So it was in the works in terms of trying to arrange that sooner rather than later to make sure that any residents there who wanted to be tested who were asymptomatic, similar to Campbellton and Dalhousie, these testing sites were set up for people who were asymptomatic, who may felt that they may be at risk, perhaps having been in contact with someone involved in some of the outbreaks right now.
Thank you. Mr. McInnes, do you have a follow-up?
I do, yes. Regarding the essential workers at now have to follow this modified self-isolation. Will there be any kind of a follow-up to ensure compliance from the province? And will that person need to report the results of their voluntary tests?
So we are working out some of those details with Department of Public Safety because, as I said, they are setting up a registration system to be able to collect the information. And then with respect to the testing results, they will need to be reporting them at some point with respect to then not having, then to be able to be released from their modified self-isolation. So the details on that right now are being worked on, but certainly the volunteer testing, they'll be identified when they do their self-referral on the online assessment form. They will be identified as such.
Thank you, Doctor. Thank you, Mr. McInnes. Callum Smith, Global News. Callum. Eloise Rodriguez, Radio-Canada.
Oui, docteur.
Dr. Russell, I understand that this new directive for travelers is for essential workers. Do you have plans to make this the same for everybody who enters the province? For now, it's difficult to say because before we have data coming from this research, because we will look at all the information and analyze it. Just like they are doing in Alberta, they are doing something similar to what we are doing. Once we have more information, results from this protocol, well, then we will be able to comment on the future. What we only know now from experience this summer with the foreign workers and foreign students, international students, they had their 14-day isolation period. They were tested on their 10th day in the province, and I think there was 1,000 people in the situation and 12 tested positive, and that shows us that the best protocol is the 14-day isolation. But because we didn't have a protocol saying that we had to be self-isolating for essential workers, we really wanted to make changes to diminish the risks because the number of COVID-19 cases are going up so much everywhere else in Canada and in the United States. And Louise, do you have a follow-up question? Yes. In New Brunswick, there is concern because when people are tested, we know the results from where the person was tested and not where people live. So it gives people a false sense of security that there is no COVID in their region. So can you explain why you give the place where the people are tested and not where they live? So I've heard this question many times. I'm trying to answer so that you can understand. It's really to analyze the cases that are linked to an outbreak and the way that we do the contact tracing and the way we analyze the situation. It's very important for epidemiologists and public health to have this information. I know that people are concerned about the way we are reporting the information on cases. That's because they want to know if it's in my zone. I want to know if there are risks here. But when cases are reported, people are in self-isolation for 14 days, so there should not be any more risks. I know that people are concerned because they want to know, but really the risk of an outbreak at any time, anywhere in the province exists, and risks keep going up because the number of cases outside of New Brunswick, like I said earlier, in July, everywhere in Canada, the number of positive COVID-19 cases were 300 a day, and now we are up to 2,700 cases announced every day in Canada. That is a very, very high risk. So I want all New Brunswickers to be vigilant, and not only be vigilant when there is an outbreak or a case in their zone. There will always be cases and always be outbreaks. You have to follow public health directives and advice to limit the spread of COVID, because we don't know where it's going to start. So to minimize the risk, you must make sure that you have a limited number of close contacts. And in BC, this suggested to limit close contacts to the people who live in your household and 6 other people. So this is what was suggested to BC, but so that we can say to limit the risks of outbreaks. This is something that we could do. We could keep wearing our masks and get tested, even if we have very mild symptoms. Thank you, Doctor. Thank you, Eloise. Mathieu Racomo, Acadie Nouvelle. Hello, I would like to talk about rapid testing. New Brunswick received very recently ID Now tests from the federal government, and soon we will get PAM-BO tests from Ottawa, and we already have gene expert tests. Dr. Russell, could you explain to us the difference between all 3 kinds of tests, or why would we want 3 different types of rapid tests? One reason is that these are new types of tests that are available now. At the beginning of the pandemic, we only had the PCR, then the gene expert. But the problem with the gene expert is that we only have so many machines and so many things that we need to have them tested in different places. So with the new one, the distribution started on October 21st, and that was decided in consultation with all provinces and territories. So the distribution was proportional to the population, and I believe that Ontario had asked a priority and made a priority request for areas where they have large amounts of positive cases. So I believe that 7.9 million tests of ID Now that were ordered, and a few more millions tests of the other kind. So that was to increase the province's capacity of do some rapid testing. So your question was, why do we have 3 different kinds? And I believe that's to optimize the testing of our population. This is one more tool that we have for fast testing, because the PCR tests take 24 hours to get the results. The gene expert tests that we have take 1 hour after the test getting to the lab. So this is something to increase the number of tools in our toolbox to fight COVID-19. So Mr. Wakomo, do you have a follow-up? Yes, please, on the same topic, Dr. Russell. Could you give me examples of when we use those rapid tests and in what context we will use the new rapid tests? Where do we use them and why and when? We have a working group on all the details given by the labs. The information I have is about distribution only. When we have the possibility to start using them, I will have more. I know that private companies will have those tests for their employees. It's only to increase capacity at the point of care, because that's something that can be done quickly and without having all the equipment needed in labs that we need for Gene Expert and PCR.
Bonjour, Dr. Russell. Petite question au sujet de cette nouvelle mesure, si c'est possible d'expliquer.
Could you please explain in French how this voluntary testing will be done and how efficient it will be? So what I heard from your question... Is it better? Can you hear me? Could you please repeat your question, please? Yes, of course. Dr. Russell, how will it work, this voluntary testing? And in your opinion, how efficient will it be? I still couldn't hear you. I believe you want to know what information we will see and how we will make changes to diminish the risk. No, I'm asking you, how efficient will this new measure be? So efficient for essential workers? Yes, exactly. We see that since July, we haven't had restrictions on people who are working for essential reasons. So people can come back to New Brunswick after working in Alberta or anywhere else, and there was nothing that they needed to do except... So there wasn't any self-isolation unless if they worked with the WorkSafe NB with a work isolation protocol. Those were specific situations, but those protocols are now going to include all essential workers. So all essential workers will be able to get tested voluntarily 3 times within the 14 days. If they want to stay here for 14 days, they can be tested 3 times. If the first test is negative, they won't have to self-isolate, which means that there are less risks than before because there were no tests, because it was part of a protocol that had been developed by WorkSafe. Sometimes it's people who are self-employed and they are not part of a protocol approved by WorkSafe NB. So this is really something that is voluntary, and even people who are working here every day can be tested twice a week, even though they don't have any symptoms. So, Ms. Paul, do you have a follow-up? Yes, thank you very much, Bruce. So, Dr. Russell, what is the situation in the other manoir? So the outbreak in Manoir La Sagesse is over, so there aren't any more risks there. In the new manoir where there is an outbreak, there is 1 case. All the residents and all the employees were tested today. And all the protocols followed in all the nursing homes are the same, so we are waiting for the results, and if necessary, our prompt team will be managing the situation just like in all the other manoirs. Thank you. Jacques Poitras, CBC.
Good question for the Premier. What are your plans for a review, the mandatory 10-year review of the Official Languages Act?
Well, at this point, we're looking at the requirements under the Act and putting a plan together. We know that plan has to be finalized by the end of December of this year, and the review has to be completed through the 2021. So we will be announcing our plans certainly within that time frame.
Thank you, Premier. Mr. Poitras, do you have a follow-up today?
Yeah, what are your thoughts on a committee holding hearings, and if so, would those hearings happen in public?
Well, that's certainly what we're evaluating at this point in time. Firstly, I want to get clarity on the requirements under the Act, so I'm sure that I'm in compliance, and then we'll look at the pros and cons of the process based on past experiences.
Thank you, Premier. Thank you, Mr. Poitras. That concludes today's update. Thank you very much. Cela conclut la séance d'aujourd'hui. Merci beaucoup tout le monde.
Thank you very much, everyone.